Suicide, which is the act of someone taking their own life voluntarily or intentionally, is not a crime. But euthanasia or assisted suicide is sometimes, in most countries, counted as a crime. At one point or another in your life, you will probably meet or know someone who has a terminal illness that will eventually kill them. But you won't want them to suffer and be in pain for the rest of their life. So if they have the option to get some medical, life-ending medication, you would rather have that for them. I believe that euthanasia and assisted suicide is the way to go if the patient has a terminal illness that is going to kill them and make them have pain. Today I will be talking about why euthanasia and assisted suicide is the way to go if the patient is willing to take this option for death. According to Christian Nordbeck, reviewed by Timothy J. Legg, PhD, CRNP, on Medical News Today on December 12, 2017, stated that terminally ill patients have the right to have euthanasia or assisted suicide as an option. Euthanasia is where a doctor will give you a lethal injection if you are totally unable to take it by yourself, or assisted suicide is where they will prescribe medication to you and it's on your own time to when it depends on when you will take it. Christian Nordbeck, who I recently said that another problem is because insurance companies like money. They like anything that will have to do with money. Chemotherapy, remission, trips to the hospital for surgeries, going into intensive care units, that all costs money. And insurance companies like that because the more money that they are getting is benefit for them, of course not for the patient. But if you get this life-ending medication, it will be just a one-time bill. It's going to be more expensive, but you won't have to pay for everything in the end. CNN Physical Assisted Suicide Fast Facts on August 13th stated that there are 6 states in the United States that allow this, which are Colorado, District of Columbia, Hawaii, Vermont, Oregon, and Washington have stated that there have been 1,967 cases where physicians have gave the opportunity for terminally ill patients to get this medication to end their life, but only 1,275 have actually gone through with this. Christian Nordbeck, who I recently stated, said there are a handful of countries who have believed in this topic. Christian Nordbeck also said that the harms for the families are social, physical, and economic, because of all the money and all the time that the families have to deal with and this patient. John Bingham, who is a social affair editor, wrote on the Telegram entitled Assisted Dying on October 15, 2014, stated that in England there are 300 terminally ill patients who committed suicide, as you would think of committed suicide, because euthanasia or assisted suicide was not an option. Now that I've talked about the problems with not having euthanasia or assisted suicide, I'll be now talking about the solutions. In 1994, businessman Elvin Sinnard, attorney Eli Strutzman, attorney Mark Trinchero, Dr. Peter Goodwin, and nurse Miriam Coppin founded Death with Dignity. Death with Dignity is an organization that allows terminally ill patients to decide when they would like to die if they have this opportunity. The requirements are you must be 18 years of age or older, you must be from one of the 6 states in the United States, and you also must be able to communicate with them orally for this request. You can't have a parent or a family member or friend say that they would like this because they can't talk or are terminally ill. It has to be orally to the doctor. In Death with Dignity, who I've stated before, also said that patients will know the time, and only the patients. No one else will. Family members, parents, friends won't be able to say that you must do this now. It is all about the patient and when they would like to do that. Margaret Somersville, founder of Center and Medicine, Ethics and Laws, posted on Globe and Mail entitled "When is Euthanasia Justified?" on April 30th, 2018, stated that the public in the United States have really adapted to this type of life-ending procedure. In people that know about this and have seen people go through this are more apt to realize that this is okay, but people who don't know anything about this shy away from it and disagree with all of this. CNN, who I have cited before, said that sometimes in a couple of cases, people pack up their belongings and move to a state where this is allowed. So if you live in Minnesota, it is not legal, so they will move to one of the 6 states that I stated before to get this procedure done. Guardian, the staff of Guardian, the editors, entitled "Euthanasia and Assisted Suicide Laws Around the World," on July 17th, stated that there are 4 countries around the world that also go along with this type of procedure, which are the Netherlands, Germany, Switzerland, and Belgium. They also agree they have the same type of requirements, and you must have a 6-month prognosis in order to get this type of procedure. Jade Wood and Justin McCarthy, who posted on "Majority of Americans Remain Supportive of Euthanasia" on June 12, 2017, said that you should be thankful for your life that you have if you do not have a terminal illness, and that you should be supportive of the ones that have this and want this procedure done. Religion and politics also depend on this. 57% of Americans in the United States said that this type of procedure is okay and agree with it. And Christian Nordvik, who I've stated before, said that this must be so that they can rest easy. If they don't want to live and be unbearable and have all this suffering for the rest of their life, and they'd like to take this route, we should all be supportive of them and get this done. Today I have talked about the problems and solutions with euthanasia and assisted suicide. I believe that we should all believe that if they are suffering and they want this procedure done, that they should have this. No one would like to suffer for the rest of their life. Who knows? Maybe this might be you in the future. Of course, we don't want it to be, but you never know, which sucks. And so, if you don't want to be in pain anymore, and this is an option, you should go for it.